Hello, my friends, and welcome back to yet another episode of I Love Being Sober. My name is Tim Westbrook. I'm the CEO and founder of Camelback Recovery here in the always sunny and always sober Scottsdale, Arizona, where my team and I, over the course of many years, have helped thousands of people on their path to recovery. Visit camelbackrecovery.com to learn more about our treatment strategies for alcoholism, drug addiction, or mental illness. And we even offer recovery coaching so that you can enjoy the freedom and happiness you've always searched for. Today, I'm here with Lane Martin. Lane Martin graduated from Stony Brook Dental School in 1998, where he received a scholarship from the U.S. Navy. After a distinguished career in the military, he went into private practice. Lane sold his practice at the age of 45 to go back to school to do an orthodontic and craniofacial orthopedic fellowship to treat snoring and sleep apnea in children and adults. So, Wayne, welcome to the show. I'm so glad to have you here.
Yeah, Tim, thanks for having me. Obviously, it was great meeting you. And yeah, I have an interesting story to share. And we've kind of dedicated our company to really helping, kids and adults that have really airway problems. And I think that so many people don't understand that, but it's really about getting a better night's sleep and just getting air, right? It's
Right. Right. Sleep is so important. And this is interesting. I've spoken with lots of different people about sleep and sleep problems. And a lot of people, they have issues with sleep. And sleeping is like one of the most important things people can do for their mental health, for any sort of recovery. And I mean, I know if I don't get enough sleep, I'm not good, man. I'm not in a good place. And just to kind of go back, you and I met a few weeks ago at an event at the Bo Easton Mastermind event, which was really awesome. And we just got to talking again about sleep and sleep apnea and snoring. And I use this app. It's called the Snore Lab, and it records my snore. It records my sleeping throughout the night. And some nights I snore, and some nights I don't. Kind of embarrassing. But one of the things you said to me when we first talked was that you can tell if someone has sleep apnea just based upon whether or not they had high blood pressure. And you said a couple of other things, which is really, and so we'll get into that, and we'll talk about kind of your program and your thoughts about why people snore and how to get them to not snore. And you've also developed a couple of products, which I'm interested to learn more about.
yeah. And I think that, looking at you and talking to you, obviously you're a fitness guy, you're in shape, you work out. I'm the same way. And no one really talks about sleep, right? Tom Brady talks about it, but I've worked out with personal trainers. I do a lot of fitness. I still play soccer, basketball, tennis, but no one talks about sleep, right? A lot of people talk about nutrition, people talk about exercise, but you know what? If you're exhausted, you're just not going to perform well. You can go 2 weeks without food. You can go 2 days without water. You can go 2 minutes without oxygen, without air,
Right.
right? That's a profound thing. And to your point, so many of the comorbidities that we see every day, right? Like I look at a medical history and we have a cardiologist on our team and he says, Lane, there's not one thing like sleep apnea or an obstructed airway that affects every organ system in your body, Tim, from anxiety to depression to ADD to ADHD to, high blood pressure to AFib to acid reflux to so many other things that affect inflammation and oxidative stress, diabetes, you name it, it's affected by airway and sleep.
I'm just, as you're talking, I'm just sitting here thinking about when I originally started doing triathlons in 2016. I didn't know how to run. Like I couldn't run. I couldn't run more than 5 miles. My IT band was giving me hell, and it was just I couldn't run. And I went and saw a guy named Larry Arnold, which he's a fitness coach. And one of the first things he said to me was, "Okay, stop." Like he watched me run for I don't know 25 yards. He said, "Stop. First thing, you're not breathing. And watch, let me show you." And he had me put on some gloves and do some boxing. And I'll tell you what, my head was spinning. And it was just like that. And if you look at most people, and once you're aware of it, once you notice it, you walk around, most people walk around with their shallow breaths, which it's like breath work has become such a huge thing. You've got James Nestor, you've got, which you talked about, James
Yeah.
Nestor, Dan Brule, Wim Hof. There's a lot of people that talk about breathing and breath work and how important it is, to your point.
Yeah. And you and I had a great conversation. We were talking about mouth breathing versus nasal breathing. And James
Right.
Nestor's book really kind of pivoted us and put us to a different level. My business partners in the book, James talks about nasal breathing versus mouth breathing. He talks about poor orthodontics. He talked about dentists really being able to recognize that. And when you and I first spoke, we're both athletes. We've both
Right.
done triathlons. There's one thing in sports I will never do. I will never run 1 mile as fast as the people that win marathons average 26.2 miles. They're running 4 minute, 4:30 minute, 4 minute, 30-second miles. I mean, if I went out right now, and I've been trying to do some speed training on the treadmill, I'm just at 6 minutes and 50 seconds, and I am gassed, man. I am like as much as I got in my tank.
Yeah.
And the fact is, if you watch them run, people from Kenya and Nigeria and Cameroon, they run with their mouths closed. They're nasal breathers. They're so efficient at running that it's incredible to see it. And I've done a lot of work. I've tested myself. I've taped my mouth shut. I've done all these things. And it really comes down to nasal breathing and getting an open airway. And, when I got into orthodontics, and really my story was I was a dentist in a very high-end practice in New York. I taught a lot. My specialty was fixing broken teeth, right? I was fixing symptoms of a bigger problem. And what happened was I taught with a gentleman named Victor Avis. And every time we would discuss these complex cases, and you've heard it, the Boesan event, Victor would always say, I bet you the person has an airway problem. And he kept saying it over and over. And I really thought it was bullshit. I was like, man, I'm a dentist. I'm doing veneers. I'm doing crowns. This is what I like doing. I'm getting paid a lot of money to do it. But after the 50th time, he started to explain it to me. Then I went and I met someone who taught this. And then I realized that so much of what I saw every day in my dental practice was really the sign of an airway problem. And it's things that we're teaching dentists to look at in a day, right? If you have broken teeth, if you have severe wear, if you were told that you clench and grind, you probably have some type of airway problem. So that's kind of how I got involved with this. And this conversation would be very different if it was 4 years ago. I kind of poo-pooed it. I was just like, this is bullshit. And the fact is, I suffer myself. I snore, right? I have an airway problem. And so much of it stems from lack of breastfeeding, the foods we ate, right? You and I probably grew up on Gerber baby food. Now we're telling people, give your kids hard food. It helps develop their jaws. Because if you look at James Nestor's book and you watch his TED Talk, he shows the skull of a caveman, and it's huge, right? It has room for all 32 teeth. Now, everyone needs their wisdom teeth out. There's no room. Our jaws are smaller. Everyone's airways are getting closed. So that was kind of a paradigm shift for me in dentistry to look at patients very differently. And I had patients that had all the comorbidities I spoke about. I knew they had a problem. I didn't know how to fix it or even address their symptoms.
Right. Okay. So what next?
So the next thing was that I met my business partner, who's a very famous TMJ airway specialist, when I was in my orthodontic program. So I noticed that a lot of the patients that I was seeing orthodontically had TMJ pain. They had jaw pain. They were clenching. They were grinding.
Yeah.
And I couldn't figure out why. And I went to Michael Gelb, that's my partner, his office. And I noticed what he does when someone clenches and grinds, he brings their jaw down and forward. Him and his father have been doing that for 30 years. They were way ahead of their time. The fact is, mainstream dentists, they poo-poo what Michael and his father did. They thought they were crazy. I've kind of bridged the gap now between them and the dentist that I was, and realized that when you bring someone's jaw down and forward, it's basically doing CPR on them. You're opening their airway. They're actually getting a better airway, and that's how we're getting patients to sleep better. When Michael and I first launched and we were teaching, we were just a learning management system. But then we noticed that a lot of the appliances that are out there were really not great. And we're like, wait, let's take your principles. We'll take my airway principles in ortho. And that's how we developed our mouthpiece. So that's part of it, where we've created the Invisalign of airway, where we train every dentist, we certify them, and we give them an appliance. Now, I was in Florida the other day. I was playing pickleball. I took my lower mouthpiece out. Girl's like, what is that? I'm like, oh, that's my mouthpiece. She's like, who needs one? I'm like, everyone. She's like, what do you mean? I said, well, do you want to perform better at work, sports, and sleep better? And she's like, yeah. I said, then you need one. So we're really trying to steer everyone, that everyone that wants to perform better and sleep better can get our appliance.
Well,
And
and
the other, yeah, sorry, go ahead.
I was just going to say, and really, I mean, going back to when you went to dental school and what dentists learn, they learn how to fix teeth. They don't know anything about airway problems.
Yeah, this
So it's
was,
like, what,
I mean,
so it's like,
yeah.
what are they going to do? How does someone really find out that they have an airway problem?
So it's by listening to your podcast. It's by reading books like James Nestor. It's becoming more mainstream in dentistry, but medicine and dentistry fix symptoms, right? Someone has high blood pressure. What do? They just throw meds at them. Someone breaks a tooth. What did I used to do? I just put a crown on it.
Right.
No one should break a tooth. And we need to get to the root cause of, why does that person have high blood pressure, right? It could be 5 different things. But instead of just throwing meds at them, why not discover what's really affecting that person rather than just putting a Band-Aid? You know, Michael and I, when we lecture, we always laugh about, if your wife or girlfriend goes to the dermatologist and she goes to get filler right here, and there's a melanoma that's sitting right here, and your dermatologist puts the filler in and doesn't tell you about the melanoma, that's like, to be honest, going to a dentist, having tons of worn down teeth, and the dentist just fixing your teeth without telling you that you really have a problem and what caused it. Now, that's drastic.
Right.
But that's really the message that we're trying to send out there, is that I had patients in my office that presented with certain symptoms and signs, and I missed them. And I missed them for a long time. And what Michael and I are trying to do is, we're trying to get every dentist to recognize that when your patient walks in looking like certain ways, they have a bigger problem than just fixing their teeth. And to your point, it's got to start in dental school. It's got to start in the schools. And then they just have to, the younger dentists have to be aware of these things.
So for the average person, most dentists are not aware of this, as you know. And eventually, I mean, through efforts like maybe that'll change eventually, but it's going to take a long time.
Yeah, and
So
it's starting to.
yeah. Okay. So for someone that thinks they might have an airway problem, like what do they do? Do they go and do they call you? Do they do more research? Do they ask their dentist? I mean, if they were to say, like your example about the person that goes to the dermatologist, that goes in and has filler and she has melanoma, if she were to go to the dermatologist and say, hey, I think I might have melanoma here. Like, if someone thinks they might have an airway problem and they say something to their dentist, is their dentist going to help them?
So that's a great question, Tim. I think right now the ADA released a legislation to basically say that you have to screen every patient for an airway problem.
Ooh,
So
okay.
it is becoming
Okay.
mainstream with the American Dental Association. Now, does every dentist do it? Not really, because dentists are still about fixing teeth. And dental school, for the most part, are about passing your boards. So the paradigm shift, I'm not telling dentists not to fix teeth. I'm just telling them to fix the teeth after you look at what caused the teeth to break down, right? The people still need their teeth fixed if their teeth are short. But the fact is, for 15 years, Tim, I just looked at people's bites. I was a bite expert. People come in with broken teeth. I built their bites up. Everything. But in actuality, your teeth should only touch for 15 minutes a day when you swallow. That's it. You need to breathe for 1,440 minutes a day. So really, the shift has to be like, we got to start looking at their airway and what's important. Because I had a dentist last week. Our appliance is also could be used orthodontically to bring someone's jaw down and forward. And a side effect is that your bite might change. And you can take certain precautions to prevent that from happening. But the dentist that we trained was, kept asking. And I said, let's get to the major point here. I can make someone's bite perfect, but does it matter if they're in a casket, if their bite's perfect, or you want to keep that person alive?
Right.
And that's a really valid point to look at. And, Michael, my partner, we talk about orthodontics being about brain function, right? Because what happens in kids, and that's a big part of what we teach, is all these kids that are on ADD meds like Adderall and Ritalin, so many of those kids, they're just not getting oxygen to their brain, to their prefrontal cortex. So I talk to tons of parents about, are your kids having cognitive issues? Are they having behavior issues? Is there a failure to thrive? Do they look tired? Did they snore? Did they grind their teeth? It's all airway. And the thing is, especially for little kids, the age of 3, 4, 5, their tonsils and adenoids are the largest and their jaws are the smallest. So many of those kids are in trouble. The big part of it is their brain development is almost 80% completed by the age of 5. So we're saying, look at these kids early. If you have a child that snores or grinds their teeth, you have to get that kid to the dentist, a pediatric dentist or an orthodontist, and have them evaluated. Right? A lot of it is tonsil and adenoids, a lot of it's anatomy, and it could be soft tissue. So when we lecture, it's really a multifactorial problem. I went into orthodontics because of the anatomical component, but so many of us, it's soft tissue, it's nasal patency, and it's anatomy.
So I have a question. We're going to back up here. So you are an orthodontic and craniofacial orthopedic doctor?
Dentist. Yep.
Dentist. Explain what that is, because I don't think I'm the only one that. Yeah, tell me what that is.
I sold my practice and I went to a new orthodontic program. Now I was really just doing it for the credibility because I had an idea in my head that I wanted to teach this to other dentists and not have the dentists made the mistakes I made. So there was a new orthodontic program that started in Hoboken, New Jersey, and our director is a gentleman named Manny Alicani, brilliant guy. He's an orthodontist, a physicist, a molecular biologist, and a biomechanical engineer. So orthodontics traditionally is about straightening teeth, right? Most orthodontists, it's about straightening teeth. What Dr. Alicani did, and he really believes that orthodontics and what's called craniofacial orthopedics, the skull development, should really be part of medicine. And it's really about kind of growing the skull, what James Nestor talked about in his book, because James had a palatal expander. So what we're doing is we're looking beyond the teeth. We're looking at the jaws, your upper jaw and your lower jaw. And that's really the craniofacial orthopedic of kind of developing that, because so many of us, myself included, we're really narrow, right? And that's what I was saying. If you look at the skull of a caveman, they're really horizontal growers like this. Most of us now, we're vertical growers. So that's, our jaws are kind of retruded. And if you look at my jaw, I had orthodontics recently in my program, so my jaws look a lot better. But a lot of times it wasn't necessarily like a Jay Leno jaw, but my profile was very different. Really, what happens is initially we thought that my lower jaw was too far forward. It wasn't that. It was that my upper jaw was too deficient. It was too pushed back.
And
So that's what we're talking about. And that's why I really love talking to orthodontists too, because they really have a huge opportunity to really impact people's lives way more than they could have ever had in terms of just straightening teeth. To me, it's not even about teeth.
no, it's I mean, that's the cosmetic component of it. It's
Of course.
the functional component of it, right? And it's just and I think about, physical fitness, right? I know you can relate to this. Physical fitness, people think, wow, like there was a guy I was talking to the other day. He's like, "Man, you're so fit. What do you exercise every single day?" And it's like, I am fit. And but that's not the whole thing. It's I'm fit, I exercise, I eat healthy, I do ice baths, I breathe through my nose, I take my mouth shut. I do all of the things because I want to be emotionally, spiritually, mentally, and physically fit. So it's all of the things. It's not just like the cosmetic component of because there's so many people that, and I hear this all the time. People are like, oh man, I just want to get fit. I'm going to go on this diet. I'm going to go to the gym every single day. I'm going to eat. And that's short lived. It's short lived. If it's cosmetic, if you're working out, if you're eating healthy because you just want to look good, that's short term. But if you want to feel good and you want to live your best life, what has to that like that's what's the why? The why behind it is so important. And it's the same thing, I believe, with dentistry, right? Is it cosmetic or is it because I want to live a better life? I want to live my best life. I want to live longer. I want to feel good. I want to get enough sleep. I want to be able to hang out with my friends and my kids and my family members and laugh and be full of joy. And I want to walk and not have a heart attack. And I want to be able to do all these things.
It's such a great point, Tim, because we were on a Zoom meeting last night with a big group that we're going to teach to, and a great group out of Connecticut. And that's what the doctor asked. He's like, why do we want to do this?
Right.
What's the why? I mean, I know my why was my mentor talked about it. I had patients in my office that died of heart failure that I knew had a problem. And that's what really the message is. If it was happening in my dental office, it's happening in every dental office in the country. Now, people might not be dying of sleep apnea, but they're dying of the comorbidities associated with having an obstructed airway. And that's the AFib, the multiple meds for hypertension, the cardiovascular problems, the glucose intolerance with diabetes, right? There's all these things that affect your body based on your airway, right? And we talk about diet. I mean, I have celiac, so I have to be gluten free, but I also don't eat dairy now,
Mhm.
right? Because it's very inflammatory, which also now helps my airway, right?
Yeah.
A
Yeah.
lot of those things cause inflammation. And that's what my partner really talks about so much. I mean, he's brilliant, Michael. He talks about oxidative stress and inflammation. I'm really the one that comes in and I don't want to say I dumb it down, but we're trying to simplify this whole process, right? Make it simple. And that's our message to a lot of dentists now is that a lot of dentists are intimidated by sleep apnea and sleep medicine and needing to get boarded. Like I went down the rabbit hole and I went to a whole other level, but every single dentist in the country could treat airway problems. They're already doing it. They're doing it when they make a night guard for a patient, right? Think about it. I mean, a lot of people in middle America don't know what sleep apnea is, but so many people know about clenching and grinding because you go into your dentist, and I used to do this too. I would tell patients, "Oh, you're clenching and grinding. Here, wear this night guard."
Yep.
But really, what that person has is an airway problem. They're compensating and they're clenching and grinding. The analogy I always use is like if you're driving your car and all of a sudden you see the light in your rear view mirror because you think the cops are pulling you over for speeding, right? Think about what happens to your body at that moment. Your heart starts racing, your
Mhm.
blood pressure goes up, and what next happens? You clench down.
Right.
So someone with an airway problem, that could be happening 200 times a night. So forget the clenching and grinding of breaking teeth, because that's what I saw. But the stress that it puts on your heart, think about how crappy you feel for that 20 seconds, right? When your heart starts racing and your blood pressure goes up. Well, if that's happening 200 times a night, your heart's not happy with that.
Right.
And that's really the shift that I never saw, was that looking at medical history now. And to your point, now I look at someone's medical history, I could look at their face and I could look in their mouth and I right away know they have an airway problem. I don't even need a sleep test. And that's a whole other level. And we do a lot of training on sleep testing and reading sleep testing and needing that. But really what we're trying to tell our clients, especially the dentists on our mouthpiece side, is just start being a better investigator, because those patients are there. I mean, the dentist yesterday that runs that group, he said, Lane, in actuality, how many people do you think in our office like have an airway problem? And I told him, I think the number is like 60 to 70%. It's a high number,
Yeah.
but so many of us clench and grind, myself included. My teeth are flat. And for years, my friend who does my dentistry is like, damn, Lane, you need a night guard. He was right. I needed something more because I really had an airway problem.
So percentage wise of just people in general, like what's the percentage of people that have an airway problem?
I mean, the numbers, so people that are diagnosed in this country are about 90 million Americans have diagnosed obstructive sleep apnea. There's probably 85% of people are also undiagnosed with some type of airway problem. Like people that really have it, so many of them are not diagnosed. And a lot of them are not diagnosed because, one, like myself, I miss these things. And two, a lot of people don't go to the doctor.
Yeah.
Right now, they're going to urgent care for some problem. But I used to have patients and I would always ask them, like, when's the last time you had a physical? And the fact is, this is why dentists really have a great opportunity, because so many of my patients hadn't had physicals in 3 to 5 years, but everyone comes and gets their teeth cleaned twice a year.
Right.
Right. So that's what, to your point of getting, these patients aware and asking their dentist. I mean, that's a great starting point. Reading books like James Nestor, reading books like by Matthew Walker about sleep, and Stephen Park is the famous ENT that talked about it, or my partner has a great book called Gas. And it talks about kind of looking at people's airways and what the problem is if you don't have an open airway.
Do you think people should go ahead, get a sleep test done?
Absolutely. I think it should be actually part of every single medical exam. I mean, I don't think it's going to be there because of insurance, but
Right.
the fact is, I think that these things are going to start being able to sleep test very soon, because right now we use two things. We use what's called a watch pat, which is a wristwatch that does sleep testing. And we also use what's called the night owl, which goes right on your finger. And it gives us a lot of great data, similar to if you had a sleep test in a clinic with a tech. It's not the same extent, but it really is giving you similar data. The other argument to this is, though, in adults, Tim, it's an incurable disease. 2 years ago, when I lectured, I would tell people, I can grow your airway, I could fix the problem. You could fix it in a kid, but in an adult, I can't fix it. I can mitigate symptoms. I can give them a mouthpiece. I can really get their symptoms down. I can get them sleeping better, get their airway open, but I can't necessarily cure the problem. And I think that's kind of where my paradigm shift was, where I really believe that I could, but now not so much.
Okay. So I'm going to ask you a question that should have
Sure.
been asked at the beginning. So what gives you the right to claim that you're an expert on opening your airway?
That's a great question. I'm not an expert. I'm just someone that kind of got trained in this, and I'm trying to spread the word to other people, mostly dentists right now, in terms of our mouthpiece, because I made these mistakes and I missed these things for a long time until my mentor pointed it out to me and I was kind of on board with recognizing it. It's like the quote by Eleanor Roosevelt: learn from the mistakes of others. You can't live long enough to make them all yourself. I've made them all.
I love that. I've never heard that quote before. That's a great quote.
Yeah, it's great. So I've taken probably 5 to 7 airway courses, like mini residencies, and I also did get boarded in sleep. So I'm a diplomat of the American Board of Dental Sleep Medicine. I went into orthodontics. My business partner's probably the best person I've ever seen teach about TMJ and airway problems. So am I an expert on it? I don't think I'm an expert. I think I'm really good at conveying the message and trying to spread the word. And that's really what we're trying to do, is just spread the word to around the medical and dental community and the public. And it's interesting because one of my best friends is an ear, nose, and throat doctor. And him and I work together a lot, especially if I think someone has an airway problem, I'll refer them to him. And he would always tell people a lot of times to put a tennis ball in your t-shirt, because he's saying the best position is to sleep on your side. Right. And you and I were talking about sleep and
Right.
positioning.
Yeah.
And I never really loved that, because I feel like you're potentially breaking someone's sleep cycle when they roll on their back. So they're either going to subconsciously or consciously wake up. So, and not that that happens all the time, but I thought about it and I was like, asked my friend, I'm like, well, what about a pillow? He's like, what do you mean? I said, what if I could develop a pillow to really help people stay on their side? Like, all right. So I took a pen and paper out and I started drawing this kind of design for a pillow.
Yeah.
And next thing I know, I took it to a guy to 3D print. So we printed like a model of this big pillow. Then we injected foam in it. And now we have like a prototype, and I have a pillow company. And the pillow thing is interesting because everyone doesn't go to the dentist, but 95% of the United States sleeps on a pillow. And if I can get a pillow that really helps people and keeps their airway open and really kind of mitigates the snoring, I mean, that's a big thing. And we were talking about it too. You know, obviously right now, and this was my point about talking about curing the problem, the only treatment available for someone that really has sleep apnea is a CPAP mask, which I'm a huge believer in if someone's compliant with it, or a mouthpiece. Now, the other thing that they're talking about, if you hear a lot of commercials, they talk about something called Inspire, which is they put something around your tongue to stimulate your tongue to kind of protrude out of your mouth if you have an obstructive event, which actually has been getting, you know, some good publicity. I'm just not sure the efficacy and effectiveness of it. The concept is great, but it's an invasive surgery. It's a pacemaker that they put under the skin of your chest, and then it's a wire that wraps up and it wraps around your tongue, and it wraps around the hypoglossal nerve, so that if you have an obstructive event, it signals it to kind of protrude your tongue. So your tongue is really the biggest obstruction of your airway and also causes a lot of the snoring sound with your soft palate. So the premise of the pillow was really to kind of get you to sleep on your side and have your tongue not fall back as much. Because when you sleep on your back, gravity takes over and your tongue falls back.
So speaking of your tongue, there was I think I told you about there was a thing I purchased. It was called let's see here. It was a program developed to help you strengthen your tongue so that
Yeah,
your
it's
tongue
probably called
doesn't
Excite. Excite.
power stopper. Okay, let me see.
Yeah, there's a couple of different mechanisms that try to stimulate your tongue and the muscles in your tongue. And it's a great concept. The other problem that lies in that is it's great if you can do that and strengthen that muscle. But really where orthodontics and restorative and general dentists can come into play that do things like Invisalign or orthodontics is you need to make more room for your tongue.
Okay.
And that's a big thing. So when we look at patients and their lower teeth are tipped in like this, their lower molars, a lot of times there's just no room for their tongue. So their tongue's going to do one of two things. It's either going to fall back and close your airway, or it's going to push forward. Most people, it's going to push forward because it's, your brain wants you to stay alive and take another breath.
Right, right. So you said there's nothing you can do for adults in terms of, once they have an airway problem, they're going to have an airway problem. So so this is an issue that's going to be with us for the rest of our life, in other words.
It is, but you can mitigate symptoms, right? So in terms of
Right.
mitigating symptoms and reducing symptoms, that's where a CPAP machine, right?
Uh-huh.
To kind of pneumatically split your airway open, which is great. It's mouthpieces, which are called oral appliances, which is taking your lower jaw and bringing it down and forward. Exactly what you do in CPR when you jaw thrust someone.
Okay.
Or, I always tell patients now, or if I'm lecturing, make a snoring sound, right? And then if you bring your jaw forward like a bulldog, like that, you can't make the same snoring sound.
You're right. Oh, wow.
Basically what
Yeah.
So
Okay.
basically that's where a dentist and an oral appliance really can come in handy. Now, a lot of times, if someone's compliant wearing the face mask, the CPAP machine, I love that because that's, we talk about efficacy and effectiveness. Efficacy is how does it work, ideal conditions in a lab. Then you talk about effectiveness. So effectiveness is really efficacy times compliance. So the issue with CPAP is a lot of people aren't compliant with it. And two, there's not obviously people that travel take it with them, but there's also the social component of if you're 35 years old and a single guy, do you want to like strap on a face mask when you go to sleep if you're just starting to date someone? Probably not,
No, yeah, yeah, right, right.
right?
That's
So
yeah,
that's
yeah.
where, that's where things like oral appliance therapy or something like Excite or there's people that are having like my buddy Dar owns a company called Rad G's, and he has like supplements where he gives people, and he's got a great formula. We recommend it in our program. So there are ways to mitigate symptoms. The issue still comes down to now it's really how your airway responds. It's a neuromuscular response of what your airway responds like. So, we have imaging we take in dentistry called cone beam scans. And a lot of times, and I used to lecture like this too, but you'll hear people lecture about, if their airway is the size of a coffee straw versus a McDonald's straw,
Hmm.
they're going to probably breathe better through the McDonald's straw. But if I told you the coffee straw was plastic and I told you the McDonald's straw was paper, guess what? The McDonald's straw is going to collapse a lot faster. Right now, if you try to drink a protein shake out of a paper straw, it's a pain in the ass,
Right.
right? So
Right.
when I lecture now, I show that slide. I show like a slide of a coffee straw versus a McDonald's straw, and then my next slide after is showing like the heights of basketball players, right? And you can't decipher if someone's going to be a great basketball player based on their height. Steph Curry's the best player in the league, and he's not that tall.
Right.
So you can't always look at. I mean, that's what we do in dentistry, and I was at fault like this for a long time. Is that I always looked at things very black and white, right? I looked at anatomy. So if I took an image of someone's airway and it was small, I'd be like, all right, that person has an airway problem. But I don't know how their airway reacts. But really, in medicine, it's kind of gray. So it's not just anatomy, it's also physiology. So we're really trying to teach our dentists that we train, don't just look at the anatomy, also understand that there's a physiological component of how that person's airway is going to react. So as much as I thought I could fix this problem with orthodontics, it really comes down to how does the tube kind of react?
Gotcha. So I guess what are some of your tips? Give me some tips. 5 tips, 3 tips for people that want to either A, discover whether or not they have an airway obstruction problem, or what can they do to take action? I mean, I know you have a pillow, you
Yeah.
have there's like what are the things someone can do? Because yes, and figure it out and mitigate the issue.
Yeah. So the simplest thing is what you use, snore lab, right?
Okay.
If you snore To me, there's no such thing as benign snoring. If you snore, you have an airway problem. And I'm
Okay.
not talking about someone that, if you go out and have a couple of drinks, obviously your response is going to be different. But I'm talking someone that snores on a consistent basis. That's the first thing. If you're snoring, or more importantly, if you have a child that snores or a child that grinds their teeth, that's a big problem. And the
And
other
just
thing is, yeah, sorry, go ahead.
I was gonna say, just to clarify, so SnoreLab is a free app. Actually, I don't know if it's free. It's
It
not
is.
that much.
It's a,
Okay,
no,
let's
it's a free app.
yeah,
Great.
so SnoreLab is a free app, and it basically records you while you're sleeping. So you wake up in the morning, and you're like, and you get a snore score, and the
Yep.
snore score is anywhere from like 0 to 150. And if it's 0, that means you didn't snore at all. And if it's they say that your score should be below 25. So if
Yep.
it's above 25, if it's 75, if it's 100, if it's 150, then you probably have a bigger issue. But that's an easy way, and you can literally, and it says, it's funny because it'll say light snoring, and percentage wise, you light snoring for this many minutes, normal snoring for this many minutes, heavy snoring, epic snoring. So epic snoring, and then you can hit the play button and you can listen to yourself snoring. It's kind of embarrassing, actually, but
You know what, Tim? It's so funny you say that because, my partner and I, when we lecture, I never ask someone if they snore. I say,
okay,
are you aware that you snore? Because the fact is, men are in denial and women speak in code. It's never like, no, I don't snore. We're never admitting it.
right,
So
right.
that's, it's interesting. My business partner and I, we're trying to figure out a way to kind of make snoring acceptable, right? Because
Yeah.
I mean, 50% of the US population snore, and it's the third leading cause of divorce in our country right now. So it is a
Wow. Okay.
problem.
Yeah, yeah,
It
yeah,
is a problem because so many people don't want to sleep next to the other person, or, it's almost like secondhand snoring. If you're
yeah,
snoring that loud, your bed partner is probably not going to get a great night rest.
yeah. Either
And
that
it
or they have
almost
to fall asleep. Either that or they have to fall asleep very quickly.
that's true. So
If they fall asleep quickly, they're okay. But if they don't fall asleep quickly, they're kind of screwed.
yeah. So that's the first thing. That to me is an easy entry point. The other thing is the comorbidities I was talking about. Like if you so many of my patients in my practice were on protein pump inhibitors, which is for acid reflux and heartburn, like Nexium or Prilosec. I always look at that as maybe that person has an airway problem because a lot of times negative pressure, it brings up, their stomach content, and that's a big thing. So if you feel like you have heartburn and it's never getting better, or you have things like silent reflux where you're like, you have to constantly clear your throat, that's the other thing I'm thinking airway. In terms of kids, the kids with ADD, ADHD, right off the bat, I'm really wanting to be suspective of an airway issue. Kids that are really small. So if I see an 11-year-old and they look like they're 5, they're not producing growth hormone probably. So they're not getting into that N3 part of sleep. And I'm going a little bit deep in the weeds, but that's something that we really want people to look at. So if you have a child that has these issues, these neurocognitive issues, get him to the pediatric dentist, get him to an orthodontist, get him to a pediatric ENT to just get evaluated, right? If you feel like you're clenching and grinding your teeth, if you have bad TMJ pain, you have muffled ear sound, also potentially an airway problem. The other thing we always say is, could you be more refreshed? I mean, I ask that question to everyone. Pretty much 95% of people are like, damn, yeah, I could be more refreshed. So I think those are good starting points. I think, even something as simple as doing what's called a coddle maneuver on yourself to see if you can breathe properly through your nose, where you kind of
Uh,
pull. It's basically what breathe right strips do, right? If you put a breathe right strips on, it pulls this. And you could tell you do it one side, you do the other side, you could see which side you breathe better out of. There's things like mute and sense, which we recommend a lot to patients because it all starts with being able to breathe through your nose. So the same thing, you can give someone a CPAP machine, you can give them an oral appliance, you can give them all these adjuncts. They can't breathe through their nose. kind of defeats the whole purpose.
Gotcha. Tell me about this pillow that you designed.
Yeah. So the pillow is basically to promote you to sleep on your side. We have one here, but I'll show you a quick picture of it. And it's just to me, Tim, it's an easy entry point. I would love for everyone that's watching this to think like, oh man, you know what? I got to go to my dentist. And we have like a great group, and I'll give people my email and our website. But the pillow is an easy entry point because everyone doesn't go to the dentist. And a lot of times that's a luxury, right? That's a luxury that people might not have. And
Right.
for the pillow, it's really simple, right? And we were talking about like, what's our brand like? Our brand is like water, right? Water is free. So is air, right?
Right.
And you need it to survive. So, the pillow, I'll show you a picture of my business partner's wife on the pillow. I don't know if you could see it on the screen here.
Okay. Yep. It's like a upside down J.
Exactly. And it just promotes you to sleep on your side.
Okay.
And, if you sleep on your side, and, I deal a lot with pulmonologists, cardiologists, and we're really talking about really trying to get people on their side because that's the best position for them to sleep without preventing their, to kind of help them from preventing their tongue from falling back. Because that's really the biggest obstruction of airway is if you have a narrow hose and then your tongue falls back and it covers it.
Gotcha. Okay. So we're coming to the end of the interview. So is there a question that you've always wanted to be asked, but the interviewer never got around to it?
Wow. That's a great, great question. I would say a question that someone would ask me is, am I like an entrepreneur, right? Like we were just talking about the Tony Robbins business mastery in terms of like, he deciphers if you're an artist, you're a manager, and you're an entrepreneur. I guess if someone asked me if I was an entrepreneur would be a great question. And I don't even know really how to answer that because I had a small boutique dental practice, but I would say out of that, I'm probably the artist.
Okay. You're
I'm
the
probably the
artist.
artist.
Okay. And because you're passionate about your product. And
I, yeah,
you're passionate about helping people learn how to sleep.
yeah. And I think that people ask me all the time, like, why did I sell my dental practice to go and do this? And I mean, I was really good at my job, but I really hated waking up every day. I think I was so physically and mentally debilitated that I just couldn't do it. And, people have watched me work. And one of my mentors is like, you have a gift. And he was right. I was very, very lucky. I learned from amazing people, right? So when you ask me if I'm an expert, I'm not an expert. I just was smart and trained with the right people. And I think it's really important to get educated. And I think that I chose the right people. And my business partner now is, I didn't know Michael well. He's a very, very famous guy. But
What's Michael's last name?
Gelb, Gelb. And that's really the name of our company. It's gelbinstitute.com. And you can see our appliance. But what I learned from Michael is what Bo talks about in our program, in our mastermind, right? What does Bo always talk about? He talked about generosity, right, Tim? Talks
Yep.
about when you're the best, you're going to be generous with yourself and your time. I could tell you that Michael Gelb, my partner, is beyond generous with him. He was so generous to me with himself and his time that we partner together. And when I see what he does and what I think we do, I would love for people to use our products and get trained by us. But if a parent sends me a picture of their kid, I'm jumping on a call probably once a day with a parent of, oh my God, you know what? My son or daughter has this. What do you think? And I'm like, do me a favor. take a video of them sleeping and send me pictures of them. And just like what you do, right? Like,
Right.
I think that obviously you're a special guy. You love waking up every day and you get to impact people's lives in a really amazing way. And I get to do the same thing. And I get to do it in a way that I could have never imagined.
Yeah.
And I think that's where I love waking up every day, because right now it's a purpose. And not only that, that's another thing for me on our pillow side, is that I was in the military and it helped shape who I am. But our brand, we're going to do what Bombas Socks did. We're going to donate pillows to active duty and veterans, because it's a way for us to give back. And
Right.
we always say it, like, why not give those people a great night's sleep? Because they allow us to sleep great every night.
Love it.
Right. And
I
if
love
you
it.
think about
Yeah.
that and that community of what they go through on a daily basis, why would you not want that person to perform at their best? And not only that, get a great night's sleep. They deserve it.
Yeah. Right. Lane, where can people find you, or how can they find you?
So gelbinstitute.com is one way.
Okay.
L Martin at gpfordental.com.
At lmartin at GPS.
dental.com, or they could put, that's our pillow is probably going to be released soon. We're still kind of not sure of the name. We're working on that. But
Okay.
if anyone has any questions, whether they think they have an airway problem, if they think their child does, please email me, reach out. I'd love to kind of help as many people as I can. And if you are in a location in a certain area, I probably can find you a dentist or one of our physicians that works in that area for sure. Because if you really suspect it and you listen to this and you think you have a problem, let's kind of get ahead of it.
Awesome. Awesome. Lane, thank you so much for your time today. I appreciate you. And I got a lot out of the conversation.
Awesome. Thanks, Tim. Thanks for having me.
If you found this video to be of value, be sure to like it, subscribe to our channel if you want to see more videos, leave a comment if you have a question, if you've got something to say. Camelback Recovery provides treatment services for people struggling with mental health, mental illness, addiction, alcoholism. So if you or someone you know is struggling, be sure to reach out to us. You can go to our website, camelbackrecovery.com, or our information is in the comments section below. And we provide everything from detox, inpatient, outpatient treatment, sober living, recovery coaching, sober companion services. So either we'll be able to help you, or we'll be able to refer you to people or treatment centers that might be a better fit. So I will see you in the next video.